All right, we're going to go ahead and get started. I know a few people are still filling in, but we want to give plenty of time for this program. We're really grateful to Tiffany and Josh and Amanda for being here today from the Department of Social Services. As you can see, I mean, this is a popular program. People really want to know what it is that you do and how we can be of service in Washington County with children and families especially. So I'm going to introduce Tiffany. I don't have any bios on Amanda and Josh. But Tiffany was appointed Director of Washington County Department of Social Services on November 2nd, 2022. But this isn't her first rodeo at DSS here in Washington County. Tiffany's been an employee at the department since 2001 and has served in many roles, including frontline work, supervision, management, and most recently at the central office in the Office of the Secretary, working with each of the 24 jurisdictions in Maryland. So she really got the broader view of Maryland before coming back here to Washington County, and we're grateful to have that vision. So Tiffany has taught a child welfare class at Shepherd University since 2018, which I did not know. And she has taught undergraduate and graduate courses for Salisbury University since 2015. She is a licensed clinical social worker and has a master's degree in social work from the University of Maryland. Please join me in welcoming Tiffany.
Thank you. They hooked me up with a different mic here.
Yes.
So it's amazing to be with you this afternoon. Thank you so much for the invitation. Both myself and Amanda and Josh, we're going to talk to you a little bit about the services that we provide as the Department of Social Services in Washington County. Now, a few moments ago, I was bragging that the technology worked, so.
Could be the wind.
If it doesn't go up, try down.
There we go. Okay. So people are often surprised when they hear how big we are as a department. We were just talking about this at lunch. So around the state, when people say Washington County, they imagine we're really far away and that we're really small. But the truth is, we're not. We're one of the largest Department of Social Services in the state of Maryland, and we have approximately 240 employees. And thank you for your very convenient location this afternoon. We just crossed the street, so it was amazing. So within the Department of Social Services, we have 4 administrations, and they're listed for you on the slide. Our administrative team does what every business would do. We have HR function, finance, procurement, all of those tasks that keep the business going. And we have a group of people that support every one of our divisions around those administrative functions. Our child support, I'll talk to you a little bit about child support. So this is payment that a non-custodial parent pays to a custodian parent to support the children in their life. So it is often used towards the child's food, clothing, rent, but we work with families and determine that monthly amount based on guidelines that are provided by the state of Maryland. So you may be familiar that one of our core functions is also around child support. Within those services that we provide, we're doing things like locating parents, right? So we have tools at our fingertips that help us find parents so that they can then be a financial resource to their children. We help establish paternity. So that may look like different tests to make sure that this person is in fact the father before we proceed towards an order of support. We can go to court, have that order established. We help set up payments for families, and then there's an enforcement component to the work that we do as well. So we want children to have what they need, right, to grow up in safe homes and have access to services. And one of the core ways that we do that is by helping parents pay support. We have other services that we can help to do that. For example, if people are struggling finding employment, we can help connect them to workforce development, help connect them to employment, help connect them to a fatherhood program or services for moms so that they can also then learn to build connection with their children in other ways. So of our 2 divisions, those are the ones that we're just going to touch on briefly. Because I think that the work that we do related to family investment and our social service programs is a little bit more in-depth and maybe generally more familiar to you when you think about social services broadly. Let me go back here just one second and say there is an email address up there. If you're working with individuals in your service, in your congregations, in your parishes that have questions about child support, this is the best way to get us. There is an 800 number people can call, or people can certainly come in and talk to us, but this email is also a great resource. We will get a personal response back within 48 hours to answer questions. And so we're happy to share that. You'll see that on our website. You'll see that on our letterhead. We're trying to promote this as a great option for individuals to get in touch with us. Okay, so I'm going to ask Amanda to join me for the next part of the conversation. Our largest division is our Adult, Child, and Family Services unit, our division here. And Amanda's going to come up and join me. She's been the assistant director for that division for the past 3 years. She also has a clinical social work license, a master's degree from the University of Maryland. She has been with the agency for about 18 years total, and she has also had other work in the community. I don't know that she currently practices as a therapist, but she's a very talented one. So if Amanda will put her mic on, and she's going to walk you through in more detail around her division.
Thank you. Down. Okay. Good afternoon. Thank you again for the opportunity to be here. I appreciate it. I want to spend some time talking with you about the division that I serve. And as Tiffany said, it is the largest division in the organization, and therefore there are a multitude of programs in adult, child, and family services. So today, I'm just going to give you a synopsis and a brief overview of the main, service components of our division. So in child welfare programming, there are 5 primary service areas. Child Protective Services, which I'm sure many of you have heard of and are familiar with. That is the service unit that is responsible for investigating and assessing concerns of child abuse and neglect that are called into our department, into our hotline. And those calls come from a myriad of places and people, and we are the agency charged with, in collaboration with law enforcement, looking into those concerns and then making assessments and then making next steps to ensure that children are safe in our community. The next program area is out-of-home care, otherwise known as foster care. And this is the service program that serves families when it has been determined that for whatever reason, children cannot remain safely in their homes with their families of origin. It provides those children with temporary care in licensed foster parents' homes or other licensed facilities to ensure that their needs are met, while the department works fervently to effectuate reunification efforts with that parent or to identify other permanency plans for children. And then we also have our family preservation services area. So there may be a family that comes to the department's attention through Child Protective Services because of concerns of abuse or neglect. And those concerns don't necessarily warrant that that child be removed from the family's home, but certainly that family is in need of additional support and additional services. And that's where our family preservation program steps in, to work intensively with that family to offer a variety of different services to include parenting skills, budgeting, assistance with housing, helping parents understand trauma, and ensuring that those children remain in their home safely. Those services can be both voluntary and also have a court-involved component. I want to spend some time also highlighting two very specialized program areas that we have in child welfare. And I want to start with our, I'm sorry, I thought I had added a slide. I want to start with the Washington County Family Center. Are folks familiar with the Washington County Family Center out in the West End? Some folks are. Okay. So this is a program that serves specifically parent and pregnanting teens, as well as families that have children ages 4 and younger. So it is an off-site location where there is a high school credit program that is offered for pregnant and parenting teens. We work collaboratively with Washington County Public Schools to provide high school education. There's an English as a second language program available for folks, as well as life skills training, adult education, and GED. Also at the Washington County Family Center, you heard Tiffany talk about the opportunity for non-custodial fathers to get linked with workforce development. We have a very unique program called the Dad's Connection, where we work specifically with, there's one component that works specifically with non-custodial parents, can be moms or dads, and then there's a component that works specifically with dads, whether you're custodial or not, to provide specialized supportive services for parents that either don't have custody of their children or dads that are looking to develop a relationship, a more meaningful relationship with their children. So that's a unique program and one that we are very, very proud of. We also have the Safe Place Child Advocacy Center. Are folks familiar with that program? See some heads nodding. Okay. That's also an off-site program, part of the Department of Social Services. And the purpose of the Safe Place Child Advocacy Center is to serve a very specific population of child victims of sexual abuse, severe physical abuse, families who have experienced a child fatality due to abuse or neglect, as well as human trafficking. This is an off-site location on Walnut Street, and it's a multidisciplinary team approach. So there are representatives from our Child Protective Services investigators that complete the assessments, the safety assessments for children, as well as representatives from all core law enforcement agencies. So we have representation from Hagerstown Police Department, the Sheriff's Office, and Maryland State Police, as well as the State's Attorney's Office. We also have a partnership with Meritus Medical Center where we can provide medical services to victims on site, as well as 2 licensed mental health clinicians, licensed social workers on site that are able to provide therapy to children and their families. And the purpose behind a child advocacy center is to reduce the trauma that children and families face when they have gone through such a horrific event. And the hope is that it reduces them having to go from this organization to this organization and this organization, telling their traumatic experience over and over and over again. It's one place where they can tell their story and then receive the array of services that they need to meet their needs. So that's the summary of our child welfare programming. And then I want to shift into our adult services programming. There are 4 primary service components in adult services. Adult protective services, which is a lot like child protective services, in that we are charged with the investigation and assessment of vulnerable adults to include the financial exploitation of adults. Social services to adults is a case management-based service for vulnerable adults in the community to link them with what they need in order to be able to maintain their independence in the community. Project Home is adult foster care-ish. So these folks do not yet require the level of care that would be necessitated in, say, an assisted living program, or certainly not nursing home care. But folks may have some physical limitations or maybe some mental health limitations that require them to just need some additional support. And we have community providers that are licensed, like a foster home. Thank you, is that better? Okay. To provide support and oversight for those vulnerable adults, to allow them to maintain as much independence as possible in the community so that they do not have to enter into adult-based congregate care. And then lastly, in adult services, we have our in-home aid services, which are licensed or registered CNAs who provide direct care services and chore service to members of our community that need help with attending to their ADLs or grocery shopping, keeping their home tidy, and we have a staff of 7 CNAs that provide that service to members in Washington County. So that concludes my summary, and I think now, Tiffany? Oh, I'm sorry. Thank you. Yes. Forgive me. I did want to take a moment just to talk about mandated reporting. And now that I see that slide, I realize it may be hard to read. But I did want to take a moment to talk about the legal obligations of mandated reporters and what that means. So in every state, the designation of a mandated reporter is different. In the state of Maryland, COMAR, family law, indicates that anyone practicing as a health practitioner, an educator, a human service worker, or a law enforcement officer is by law a mandated reporter, which means if you have any at all suspicion of child abuse or neglect, you are legally mandated to report that either to law enforcement or the local child protection agency, which would be us. Child care and daycare providers are also considered to be a part of that mandated reporter population. And the law tells us that if you are a mandated reporter, your obligations are as follows. If you have a report, a suspected report of child abuse or neglect, first we would ask that you call that in immediately to DSS or local law enforcement, and then you file a written report, a follow-up report with your concerns within 48 hours. And for those that are interested in reading the actual citation in COMAR, it's listed there for you. It's quite lengthy. I just took out the important tidbits for you this afternoon. And I think that it's also very important to highlight that even though by law in Maryland, those are the only people that are legally obligated to report child abuse and neglect, I feel confident in saying that we share the opinion that everyone in this room and anyone that comes in contact with children and families has a moral obligation to report those concerns if you have them, because the law does not require there to be any evidence that abuse or neglect has occurred. We're only saying we want you to call if you have a suspicion. And if you make that call in good faith, you are immune from any kind of civil liability or criminal penalty that could come along with that. So there in red is the 24-hour hotline number to our Department of Social Services. It is manned all the time. And so if you ever have a concern about child abuse or neglect, or elder abuse or neglect for that matter, we would strongly encourage you to call that number or again call your local law enforcement.
Thank you. We're definitely going to build time for questions into the presentation today. Also, let's take a minute and talk to you about our family investment programming. I'm going to introduce to you Josh Bond. He's been in the role of Assistant Director for Family Investment for the past 3 years, but has been an employee at the Department of Social Services for 14 years, so since 2009. He has a communications degree from Shenandoah University. Josh?
Good afternoon, everyone. Thank you for the opportunity to speak a little bit about family investment today. Family investment broadly is food stamps, medical assistance, cash assistance, things of that nature. Things I wanted to touch on today are a couple changes you may have heard here in the community that changes to benefits have begun effective March 1st. So in March of 2020, Congress authorized a temporary increase to all food stamp benefits to help through the COVID-19 pandemic. Then there at the tail end of beginning of January, they passed the Consolidated Appropriations Act, which ended that. So effective March 1st, all clients' benefits went down to what they actually received. So a very real-life, real-time example could be that someone had been, since the onset of the pandemic, receiving, let's just say, $200 in food stamp benefits. That may be their amount, it may not be. Our food stamp calculations are based on income, shelter expenses, things of that nature. After those calculations, perhaps their amount, just for example, was $200. However, perhaps their actual amount could be the minimum, which in this case is $40. So in some cases, clients' benefits went from the maximum to the minimum. That took effect March 2023, so that has affected a lot of members of our community. What we at the department are ready to do and stand by to do is that any time your benefits may have decreased, that may be because of the federal mandate. However, if you have changes, income, shelter changes, anything like that, we advise all customers to report it, whether that's in person, over the telephone, through email, through the websites, which we'll provide later. Report those changes. We can reconsider your case at any time. Perhaps those changes will make a difference. Perhaps your benefit amount will rise. Perhaps it won't, but we take everything into consideration. So I would stress that to people that you're working with, that you may come across that their benefits have dropped. I would encourage them to reach out to us. With those changes, there are some documentation required. So perhaps you were working, when you reported that, your income has changed. Perhaps the pay stubs, perhaps the pay has went down, perhaps you've ended a job, something like that. All changes we make have to be verified as well by some kind of documentation. So if you'd like to change your amounts, as long as you can provide the requested documentation, which our case managers will let you know what you need. We'll make it very clear that you need to provide this, you need to provide that. Whatever it is, you can provide that to the department, and we will reconsider your case. Again, it may affect the amount, it may not, but we're happy at any time to reconsider that.
Josh, so as you might expect, this is one area that we anticipate a tremendous impact to the citizens of Washington County, right? So if you were used to receiving a maximum benefit, in this example, $200, and now your benefit would be adjusted to $40, right? That's a large difference. We know, you know how expensive food is when you go to the store to feed your families, right? So this may be an area when we're thinking about how the faith community supports the department and the people we serve in Washington County, like keep that in the back of your mind. We do anticipate increased need, particularly around food security.
So to kind of help with these changes, the Department of Human Services, whose umbrella we fall over, has created a new website that details the changes that I just outlined to you, and as well as some additional resources to support households throughout the state. I've attached the website there as well. It's a nice website, very thorough, to kind of give background. There's some videos, other information, so that will be included with the presentation as well. With the changes to the food supplement benefits, also have come some changes to medical assistance. So medical assistance since starting in May of 2023, Medicaid recipients, which is what we do at the agency, will be required to once again renew their benefits every year. Again, this was tied to the pandemic, just like the additional food stamp benefits were, but during the course of the pandemic, if you were on medical assistance, your case continued to roll over. Every year before the pandemic, you would have to recertify. Recertification paperwork would go out, and they'd have to complete it. But at the onset of the pandemic, that was waived. So your case was continually extended without any kind of no-touch cases is essentially what we referred to them as. We could only close medical cases in very narrow requirements. That is, if you move out of state, or unfortunately if someone were to pass away, then we would close their case. Otherwise, your case would continuously roll over. Beginning in May of 2023, that requirement is waived as well. So customers will receive a packet in the mail around about 60 days before their renewal due date. So if their case is due in May, the end of May, it would count 60 days back from the end of May, and they would get their paperwork in the mail. The customers need to complete that information and return that to our office. If they don't, unfortunately, their case could be subject to closure. As we talked about with food stamps, there are requirements as well for verification. So as they fill out those packets, if they have any kind of income, we would need that information as well. If it's Social Security, we can verify Social Security through our agency. That's no problem. But anything outside of Social Security, they would need to attach that. Now, if they don't, that's okay. We give them a request for information, give them plenty of time to get it back. But if we don't receive it back, or any other verifications that we request and outline to the customer, the cases will close. If a case closes, that could lead to a potential lapse in medical assistance coverage. So again, as we interface, make sure if customers are reporting that they're getting that information, that for the first time in a very long time, they do need to return that information. If they don't, the case will close based on when their case is due. In addition to what we talked about here, in addition to that website that the state has set up, we right across the street have a list of various community resources that can kind of help with not only the food side of things, but with the medical side as well. That we have paper copies, and we can also email it to any clients at any time. So that's one of the big changes. And here are a few more helpful websites. The first one is the website based around the ending of the maximum benefit amount. The My Maryland Think is the online portal that customers can go to and apply for benefits. We can also do paper applications through the mail or whether at the department, but if anyone was interested in online applications, that would be the website they would use. And then also that's the Maryland Health Connection, which is a medical website where customers can sign up for medical assistance. And this is our information, contact information directly. Just like child support earlier had an email address set aside that you can reach out to child support. We have that for family investment as well, washington.fi@maryland.gov. Again, we turn that around in 48 hours or less. That's probably the best way to reach out to us, but we are open at any time, as well as they can contact our case manager. That is the 800 number, and directly under that is also another line that we maintain for our family investment division specifically. And just for fun, there's our Facebook page on there as well, if anyone is interested in that. One more thing I'd like to touch on briefly that has kind of cropped up and is a topic of a lot of conversation, not only in Maryland but also nationwide, is EBT fraud, and more specifically, EBT benefits being stolen off participants' cards. So the EBT card is the food stamp card. It stands for electronic benefit transfer, but in broader terms, it is the food stamp card. Customers' benefits, through no fault of their own, were being taken off their card electronically. That is a nationwide problem. However, Maryland is the first in the the first in the country to roll out a new benefit replacement program. It's not quite ready yet. Hopefully we should have some news potentially by the end of the week, but it will be ready. It's a simple, streamlined service that can get the customers the benefits back on their card. So there will be online, but there will also be paper applications. Whichever the customers prefer, we can help in either way. And we hope to get the benefits returned to our customer's card within 15 days after they complete the form and it's processed. One caveat is that the benefit amount can only be 2 times the monthly allotment. So unfortunately, if someone had $600 stolen and their monthly amount was only $200, we can only go to $400 essentially. That's just a federal rule. That's just some information to give some background just in case, but it cannot exceed the actual supplement that was issued for a month. So that's good information we just put out there to let people know. At the agency locally, we are setting aside a computer lab. Customers can come in at any time and report, that their benefits were stolen. Customers can use the computer lab to fill out this form, and then it will be processed through there. Additionally, we have staff on site ready to take any paper applications that come in. If customers prefer paper, we can certainly accommodate that as well. Customers can access, when it's live, they can go through the My Maryland Think website if they'd like to do that at home, complete the application, but we also stand ready at the department to help in any way. We'll have someone there to guide them through the process and walk them through the website and kind of answer any potential questions that they may have. But we're very proud to say that we're the first state in the nation to roll this out and to make it right for our customers. So, thank you.
So I don't know how many of you have had the unfortunate luck of having your credit card be victim to fraud in some way.
Yes.
Right? Yeah, I have, right? And I just called up Visa. I didn't have to pay for that. They took care of it. They magically made that right for me, and they sent me a new card, and 2 weeks later, I'm using my card again. So unfortunately, when customers who had either cash benefits or food stamps, right? So SNAP stands for Supplemental Nutrition and Assistance Program. When they had their food stamp benefit taken from their card that they use like a debit card, then we had no mechanism to make them whole. It wasn't just us, right? It wasn't just the state of Maryland, it was across the country. That there was no federal reimbursement to replace that benefit. Okay. So we had people in the community who were not able to access benefit, cash assistance, food for their families. Because of the federal change in December and because Maryland was the best, we have a plan ready to go. And it's our intention to make people whole now. And so the process that Josh was talking to you about is how we can help families now, even though we weren't able to in the moment. So that is a quick overview of what we do. We do all of that and more, right? We just had a short time to be with you. We wanted to allow time for questions. As we head into the next few years, we're talking about strategic planning. And at the beginning of April, we're going to have a strategic plan for the agency. And we're talking about things like, how do we support our workforce around recruitment and retention and recognition? And we're talking about how do we enhance communication so that people understand what we do and what's out there in the community and how we make connections for people. We're talking about how we build diversity, equity, inclusion, belonging. We're talking about how we leverage community partnership, which is really the work that we want to speak to you about this afternoon also, is how the faith community can support the department, how we can work together, where we can bridge gaps in services. And what's the last one? Oh yeah, the most important one, customer service. Because our priority going forward will always be optimal customer service. That when people come to us for help, that they get what they need. And if it's not from us, that we're able to successfully connect them to someone who can help. And if we're not the solution to the community, discussion that's happening, we intend to be part of the problem-solving process, right? So that we're going to contribute to what that solution is, even if we're not always the answer. So when we had an early discussion, we said, how could faith community support us? And we're really open to your feedback on that. We see this as the first discussion, not the last. We hope it's one of many. Early on, we're thinking things like, is there support to staff, right? We have caseworkers and social workers that see terrible things. We sometimes... That's all right, we're good. We've adapted to Texas. We see things that sometimes we just can't make sense of it. And we just don't understand how things like this happen in our world. And our caseworkers really struggle with, do they want to do this work? Or what does that mean for their faith? And so are there opportunities there? At our Safe Place Child Advocacy Center, we interview and intervene with children who are victims of sex abuse. And recently there were a few of us who were in a conference and they talked about the faith crisis that could often happen as a result of the abuse. And so is there a connection there that we can make with our faith community so that if a 6-year-old is struggling with why bad things happen to little girls, that we could help build a connection there for her. We need resource parents like crazy. If anybody would like to foster, raise your hand because we'll take your name right now. How can we maybe partner with the folks that you're serving? Because we need people with good hearts and good intentions in this community to foster kids of all ages, particularly teens. And related to our adult services work, we need project home providers. So when Amanda said adult foster care. We need people who would open their homes to adults too. And so those are some early ideas that we had around what that could look like. And there's also really tangible things. So for example, related to our project homework, we're going to do a celebration. We haven't done it in a very long time. It's been years, where we want to acknowledge and celebrate and raise up the people that open their homes so that adults can live safely in their community and not in facility. But we don't really have a place to do that. So sometimes the faith community has access to like pavilions, or they have a great place where we could have a picnic on your site. And if you're willing to like be a resource for us in really like tangible ways, we'd love to hear about that too. So those are some of our early ideas. We definitely want to hear your ideas about where we build those bridges, and we would be happy to take any question you have about anything we've talked about today or anything we haven't.
So I have a microphone and I'll bring it to you, and maybe the batteries will last, and maybe, you know, we know that joke already. First question, Tiffany, can we have access to some of those slides that had key phone numbers and website addresses so we can distribute that?
That's a super easy one. So yes, no problem. And my understanding is they've recorded this presentation today also. So there may be possibilities there. I'm not sure how you would intend to share it, but yes, we can make that. Just send it to Kathy. Was that the best option? Okay. So we'll send the slideshow, which have a lot of those key websites, Facebooks, phone numbers, and some of our contact information.
I have a pretty loud voice.
Well, wait a second, this will record it.
I occasionally fill in the front office at my house of worship. And I was told about the time the pandemic started that when people call and they're asking for direct help, to refer them to the CAC. Does that still stand?
Are you speaking specifically about housing assistance, food assistance?
It might be any of it.
So let me speak first to housing. So the short answer to that is yes. The Community Action Council is the organization in this community that is deemed the lead in housing. So whereas I know my division, Josh's division, all of the divisions may have small windows of opportunity to assist current customers or clients with housing needs, we are not the leading housing expert in the community, nor do we have the funding to support broad community initiatives when it comes to housing. So the short answer to that is yes. And also, if they are already involved with the department, I would encourage folks to have that direct conversation with whomever their caseworker is about what we can do to assist in those situations.
I just want to build on that just for a brief moment and say if it's a food insecurity need, there's a number of food banks, a number of food resources in the community. Our partners at REACH happen to be with us here today. I had a tremendous meeting with them recently, and I learned so much information about what was available in the community that I did not even know. Like, for example, that people can access a hot meal almost daily, right? At different places in our community. And so REACH has tremendous resources. They actually give us a lot of information that we share out. And so a lot of it, I think, depends on what the need is. But Washington County is a resource-rich community in a lot of ways.
I have two questions. Actually, I have about 437, but I'll keep it short. One is, what is being done to address the fact that abuse occurs? And the second question is, who set this $40 a month limit? What is it supposed to buy? I mean, I don't smoke anymore, but I think it would buy a carton of cigarettes. I don't know. And what can the community, not just faith community, but what can the community do about that? Or is it a federal law that needs to be changed? What can be done about that? Because to a family who was getting 200 and then getting 40, it's devastating, right? Thank you.
Thank you. Yeah, I appreciate the question and the dilemma, right? Because if any of us have shopped for eggs, right? So it's really, I'm going to need Josh's help on the technical answer, but eligibility, benefits, right? It's all policy driven by the federal and then to the state government. So very little within our control. I don't know how you would add to that.
Yeah, I wouldn't add much to that. Unfortunately, it's federally mandated from the state level. They disseminate it from there, but we have no control whatsoever over the amounts. And we've heard that a lot just in the last 2 weeks. What is $40? Or in some cases, it's a dramatic drop off. And yes, we wish that it could be more, but our hands are completely tied by not only the federal government but the state government as well. So.
And
What
to whom
we
do we
do-
complain?
Your congressional representative.
What we do then is find other ways to assist families and people who need help, right? So the benefits that people receive are income-based, it's formula-driven, it is policy-driven. When people have other needs, then that's when we depend heavily and gratefully on community partners. That's when we talk to REACH. That's when we reach out to our food banks. That's when we're connecting with Community Action Council, right? Where we try to provide resources to people to bridge that gap as much as possible, because we do recognize that that people will struggle. To your first question, I'm sorry, she had two questions. I'll answer that other one really quick and then come right back. The question about what are we doing around child abuse and neglect? So it would always be our preference to prevent it, right? And in a lot of ways, when families have what they need to take care of children, then that is prevention. When we have child support coming in and children are supported through child support, that is prevention. When families have access to cash assistance and medical care and food benefits and preschool, that is prevention. We reach out and do prevention work in the community in lots of different ways through lots of our programs. We do have a number of family preservation and school-based programming that focuses on prevention. That's a piece of it. Also, the way you protect kids is making reports when you suspect there's abuse and neglect. And we use a set of legal criteria to determine whether it meets that threshold where we can knock on a door and intervene. The intervention that we provide around Child Protective is always about keeping children safe with their families whenever possible. Our last resort always is foster care. We would never start at that solution unless, it's absolutely critical, life or death kind of situation. So what we're doing about it, right? We're doing prevention work, we're making sure the families are strong, we're making sure we have a strong community so that families can thrive within their communities, and supporting other community-based programs to help that happen in lots of different ways. And then when we know that families are struggling for any number of reasons, we intervene as quickly as possible.
I'm appalled at the $40 amount for food. Is that based on one person in the family or the entire family?
So the $40 is a broad example. That would be based on one person. So that's the one person minimum. As you increase your household members, so do the grant, whether the maximum or the minimum. So the $40 is the most real-time example for one person. One person.
But still. Thank you.
Thank you.
Thank you. I saw an advertisement from Casa de Maryland for foster care, and I wanted to ask if that is independent or in partnership or part of the foster care that you do in our community.
And you said it was of CASA?
Casa de Maryland for like adolescent children, and they said specifically for Washington County.
I'm not familiar with that organization. Amanda may be. It's not under our umbrella, but I would say to you that you can become a public foster parent through our agency. There's also opportunities for you to work with private agencies that provide foster care. So it sounds to me like they're probably a private foster care provider that contract with departments all around the state to provide perhaps even therapeutic level care or regular care just through their agency, not ours, which means they would do your home study, your licensing, your training, all of that would be through their agency versus ours.
Hi, I know that Washington County has a substance abuse problem. So are you guys partnered with Meredith? Are we partnered? With Meredith Medical?
Yes, with Meredith, yes. So Washington County does struggle with substances in many ways.
Okay, so the question was, babies that are born from parents that suffer substance abuse, do they have like a volunteer program where you can just go in and rock the babies? I know some states do that.
Yeah, they used to, because I'll tell you, I've been here a long time, since 2001. For 7 years, I did the work that you're talking about, intervening with those substance-exposed newborns. And Meredith did have a program where people could come in and rock babies and provide comfort care. I don't know if they still are doing it. We're setting up a meeting with our partners at Meredith to touch base. So it's one of the things we can ask about, but they used to do that.
Okay, because I got free time.
You want to be a foster parent?
We have a baby rocker.
I mean, you could go rock the baby, or you could just like take care of them 24/7.
I got grants.
Tiffany, you talked a little bit about what the department does to help prevent trauma or help prevent abuse and neglect. What can the faith community do to help with that in our own spaces or the community?
Thank you. I'll ask Amanda if she wants to build on or to my answer. I think doing what you're doing today, right? Coming together and learning more about the work that we're doing and saying, how can we partner with you? And if you want to do things within your own organizations, congregations, parishes, synagogues, I want to capture all the language, but with the people that you're serving, we'd be happy to do that too. If you have groups that meet in your church, you want us to come out and connect with you personally, we'd be happy to do that. Continuing to have safe space for kids and families to come, have resources, right? I don't know if you have mentorship possibilities through your work. Those are things that we can't really connect right now, but you might be able to.
When you talk about prevention, interception, and disrupting the cycle really is key in that. And so any time where you can provide a safe place for families and also help them learn a different way. For those of you that work in this community and have for some time, it is no secret that we see a cyclical pattern in some of the families that we serve. And when we talk about prevention, it's about breaking that pattern. And so anytime you have an opportunity to offer healthy outlets for families and children, or healthy parenting education, just about what that means around how to have a good time with your kids, it's developmentally appropriate. All of those things are ways to prevent child abuse and neglect, and ways that members of your fellowships could do very, very positive work in the community.
Yes, I know you asked Chicks a question about a private firm dealing with foster care. I'm just wondering, from an unbiased assessment, because because I'm thinking if they had that, that might be from all. What benefit would it be more so that you could offer going through you than something? Just trying to be real here, because I'm not knowing if they're coming from there, coming from here. What benefit would you say that you can offer other than that they would, that might be more inclusive?
Well, you see, you asked for an unbiased opinion.
Yeah.
So that's where I'm struggling. So there are a lot of good providers across the state, both at your public Department of Social Services and private agencies. So I think that largely depends on the family and who can best meet their individual needs. I would say we offer, the home study process, the licensing, the training. We offer training every year. I know our staff, so I want to believe that we're going to do a good job and do right by our foster parents. We have appreciation. We're going to listen to you as far as how we can have a successful experience for you as a foster parent. But there are lots of private agencies that do that well also. Again, I think it just comes down to what your needs of your individual family may be. I would hope, right, in our community, people would consider us first, or at least consider us as part of their option. We would almost exclusively place youth Washington County, right? So we have custody of a child, they're removed from Washington County, we would like to place them in Washington County. Many of the other private providers place children from all over, like, the state. So if we have to have a child in out-of-home care, we would really like them to be in their community so that they can stay in their same school, so that they can stay in their same sports team, so that they can keep attending their church, right? So that they can keep connected to things in their life that are consistent. And that's why it's important for us that we have local providers also.
Thank you so much. I'm sure we could go on for questions for another hour, but unfortunately we don't have that. Thank you. Very grateful for all that they do. Really, it's not easy to be a social worker, much less manage the work. So thank you. Just a few announcements, because I know we're already at time. If you didn't get a chance to sign, there's a couple of cards downstairs for Ed Poling, who, as many of you know, is going through chemotherapy right now for bladder cancer. So if you have he's has a wonderful spirit. He's going through this with just the way you would anticipate that Ed would. But he still needs our encouragement, our prayers, and our love while he's going through this. Good Friday walk. Just wanted to remind everybody we got a not everybody, but for the Christian folks here, there's a Good Friday walk from 1 to 2:30 at City Park, and thanks to members of the planning team, a few of you are here for helping us put that together. But we're looking forward to a good turnout for that again as well. Also upcoming April 18th, so normally our meeting is the second Tuesday of the month, but that is that would be 2 days after Easter, a week after Passover. It's a challenging time, so we're gonna meet instead on April 18th. We don't have a location yet, so anybody volunteering, let us know. But we do have a program. Tanya is going to lead that program. Actually, the Washington County Black Professionals Network is going to present. A panel of black business owners sharing their experience being in business in Washington County, and what their challenges are, successes, and how the faith community can support businesses as well. Then we are working on potentially a meeting maybe for May, maybe not, for a 3-hour workshop probably. That's kind of what we're going with now, for how ways we can share our resources as houses of worship. A lot of us are having challenges. How can we share maybe spaces, children's programs, you know, even staffing and things like that. So just kind of thinking outside the box. And so we're not sure exactly what that program will look like yet, but who here would be interested in that kind of program? I just want to kind of get a gauge. Okay, see, yeah, okay, great. And I think that's about it. Am I missing anything? Anybody have anything major? Yes, please do. Oh, you got it.
Yeah, they didn't take the mic away from me yet, so. I'm sorry, I just want to say, just in closing, thank you so much for the invitation to be with you. We appreciated our time, the partnership. We look forward to more conversations. And I was thinking, you know, we're always careful about that church and state thing, but when I was listening to Kathy close out, I was thinking, oh, right, another great way you can support our work is to pray for us. And pray for us in doing the work and pray for the people we serve so that we keep doing all the good we can in all the ways we can. Thank you.
Thank you, that's beautiful. And speaking of prayer, who's closing us out in prayer? Is that Chris, Mark?
We just thank Tiffany for your being here, and the team, Amanda and Joshua, thank you so much. And thank you, Richard, for hosting us. Thank you, Pastor Doug. And we keep Pastor Doug in our prayers. He's sick. He's not here, but hope he will be well. Thank you all for coming out, and God bless you as we go. Now, Almighty God, we thank you for your grace. We thank you for the healing that our people need. We thank you for the Department of DSS. We pray for them. We pray your blessings of wisdom and counsel. Oh God, that there will be no partiality, but there will be fairness and equality in business and in taking care of the clients. Bless our state, bless our city, bless all our people. Those who are hurting, we pray for them. Those refugees who are migrating from many places, Lord, watch over them. Watch over us now as we go. May your blessings of peace and joy and mercy be upon us till we meet again. In the name of the Most Holy One we pray. Amen. Amen. Thank you so much.